Hi, everyone. I am Dr. Anna Cabeca, and I am thrilled to be here with all of you at our virtual KetoCon Summit. So thank you for having me. Today, I want to share with you a little bit about myself and my journey, and I'm going to talk about how we improve our health before, during, and after menopause. I will give you some cases from my clinical work, as well as my scientific experience, and now working with hundreds of thousands of women around the world in my virtual programs. So I am Dr. Anna Cabeca. I am the girlfriend doctor. I am Emory University trained in gynecology and obstetrics, and also board certified in beyond OBGYN, board certified in integrative medicine and anti-aging and regenerative medicine. And I have traveled the world looking for healing modalities, part of my own healing journey, as well solving my own problems, which I'll tell you about too, some of them. And because of course I have many, like who doesn't, right? But as many of us in the integrative world have had our own, I wouldn't want to say failure of our standard of medical care, but recognizing that our medical care goes beyond what we can prescribe on a prescription pad or do with our surgical scalpel. So I'll share some of that with you today, and we'll get started. I'm going to share my slides. Oh, yeah. And I should mention that I am now the best-selling author of 2 books. I want to share that with you because they are fabulous and I highly recommend them as resources. So my first book, The Hormone Fix, and my recent publication, Keto Green 16, a 16-day plan that incorporates many of the philosophies that I'll share with you, but with intermittent fasting and a keto green diet. I'll tell you what that is too, if you're new to this concept. So today's topic is about helping women live better lives before, during, and after menopause, especially during times of transition. Hormonal transition, whether it's our cycle, PMS symptoms, whether it's post-pregnancy, and whether it's in menopause. All these transitions affect us in so many ways, not just our reproductive life, but it goes beyond that to our neurobiochemistry and our, we just go on to our psychoneuroimmunology. I mean, just how our brain, our body, our vitality, our immune system, and certainly how our reproductive hormones and endocrinology are all interrelated. So we're going to talk about what women experience and why, and also what is happening before, during, and after menopause. Also what women want and need and how we help. So as I mentioned, I am the girlfriend doctor, and I am the first call for women who have questions. She would only ask her best girlfriend if her girlfriend was a triple board certified OBGYN. As a result, I get so many questions about women's bodies, mood, libido, and certainly about vaginal issues, complaints about dry vaginal concerns, painful sex, sleepless nights, self-doubt, weight gain, memory loss, and fear, and questions about what the rest of our life, the rest of her life is going to look like and how she can regain control. And I think this is a really important point because we have to take back our control, our power over our own bodies. And this goes beyond what we eat. This goes into every choice that we make, from the thoughts that we keep in our heads, that we choose to keep in our heads, the way we look at our world, as well as all the way down to the nutrients and supplements that we take and the plan of life that we follow. So when it comes to transition, and especially during the transition of menopause, I really want women to know, first of all, we need to breeze through menopause into the second spring, into our second spring. And menopause is just a terrible word. It just has it's just not a feel-good word for whatever reason. I do want to change that. But in Japan, the word for this time of life, once we pass through menopause, is called konenki, which means second spring. So I say we want to breeze through menopause into our second spring, and how liberating that is, how good that feels. It also should be a seamless transition into this stage. And that's what I've seen happen. And we can certainly create that in each of our lives. And again, this applies to you if you are dealing with PMS symptoms, if you are having irregular cycles, if you're having menstrual cramps, dysmenorrhea. In general, if you are women, listen in, because I'm going to share with you some tips along the way that are just going to improve the quality of your life, no matter how old you are right now listening. And I tell you from my heart, because I'm a mom of 4 daughters from age 12 to 31, that implementing these changes in your life flows into your daughters' lives, and that makes a huge transition. Really, really nice and beautiful transformation within your entire house. And right now we are all in our Keto Green 16 plan, and all my family is doing it with me, and it is really beautiful to see the lights turning on, the understanding, and like all of a sudden they're saying, Mom, I get it. I understand why you recommend doing these things, and they're experiencing it for themselves. But it starts with you, each and every one of you, taking your own self-care back as a priority in your life, and then that flows through to everyone else around you. So, and this is so true right here, that by the time a woman's reaches menopause, man, we have lived some life. We have experienced some trauma. And, we've been through some shit. We certainly have been. And that's okay. Oftentimes the scars aren't visible, right? They're not seen. They can be emotional scars, mental scars, relational scars. And it's a time to, as we breeze through menopause into our second spring, to let that go, because it no longer serves us. These traumas, these troubles have no longer served us. And we are now wanting to be, and are equipping ourselves to be fully committed into the next stage of our lives, or whatever stage of lives we're in right now, to have a better tomorrow than we are today, a better season of life than we have. And another big point is that I know my clients are savvy consumers, right? Looking for real life solutions that make you feel more energized, vital, sexy, and beautiful. It's all part of aging gracefully. So, to be clear, menopause is not an ending. Menopause is absolutely not an ending. And it definitely can be a time of expansion and delicious freedom, a time for us to grow, a time for us to live passionately, to experience all the pleasures that are in our life. So, women who are armed with solutions, it is a time of walking boldly into our next chapter of life, then our next season. It is time to rise from the ashes and be the phoenix that we were meant to be, living passionately, boldly, beautifully, and by example, that we can mentor and support those around us. Now, this is how I can help. In my business, I've created unique products and programs specifically designed for women before, during, and after menopause. So some breakthrough self-care products that I formulated because I didn't have anything to help me that met the criteria, that was natural, and that really worked. And so through my own journey, and through helping thousands of clients, I've created self-care products as well as programs to empower us emotionally, relationally, certainly physically and physiologically, as well as even spiritually, through major transformation. So let's talk about women before, during, and after menopause. What is happening to our hormones? Our hormones are shifting over time. There are symptoms of, we see here, I'm showing you a graph of our hormonal changes over time. Now, this isn't exactly to scale, but for level of importance, I want to show you. Our DHEA hormone starts to decline in our mid to late 20s. And we see a peak in DHEA mid to late 20s, and there's a start to decline thereafter. We get the cyclical swings in puberty. If you remember experiencing your own puberty, or you have a child in the house right now going through puberty, you can probably relate to, like, what is happening to my child? out. And smoothing out that transition is just as important as smoothing out our transition in the menopause, and neither of them are diseases. I really want to be clear about that, because we treat menopause like a disease. It is no more a disease than puberty is a disease. And so owning that, owning this natural shift and transformation is powerful. So progesterone, our top hormone here, is my absolute one of my favorite hormones, and it is progestation. Progesterone comes from the words pro, for gestation, pregnancy, right? For birth, for supporting life. And so it is one of its roles. It has many roles, which are often overlooked, but one of its roles is to support healthy pregnancy. It is the hormone of dominance during your second half of your menstrual cycle. We call that the luteal phase. And that's after ovulation, because it is predominantly produced by the corpus luteum that is there and designed to support a fertilized egg into its cushioning within the uterus. And it starts to decline in general in our mid to late 30s. We start to see a decline, a shift in progesterone, a relatively sharp decline with a decrease in ovulation, less frequent ovulatory cycles, and often that leads to what we call estrogen dominant. Estrogen also is starting to decline in our late 30s to early 40s, and we start to see this decline, but not as drastic as a decline as we see in progesterone. And testosterone also declines. We hit peak levels in our 20s and 30s and a slow decline thereafter, all leveling out into our postmenopausal years. Now, these symptoms that I want to show you, these symptoms of estrogen dominance, if you look at them, they are PMS, premenstrual symptoms, and that certainly can be experienced younger ages and often can be associated with inadequate progesterone production or overproduction of estrogen or estrogen toxicity. In this time of estrogen dominance during this perimenopausal transition, which we call between age, essentially, plus or minus 5 to 10 years from the time, around 5 to 10 years before we end our periods, we can experience this perimenopausal transition. And so we can experience hot flashes, night sweats, weight gain, brain fog, lack of libido, irregular menstrual cycle, dysfunctional bleeding, breakthrough bleeding, reasons you come to the gynecologist, and heavier than normal bleeding as well, and sleep disturbances, waking up in the middle of the night, not being able to get back to sleep, as well as not waking up feeling, rested, and bone loss. We experience that during this time as well. We know from science that progesterone decreases 75% from ages 35 to 50, and estrogen decreases approximately 35% from ages 35 to 50. So again, a steeper decline in progesterone over estrogen, but all decline, and all are vitally important. And so what I want you to look at is recognize that slope of this curve and this shift in the way our reproductive hormones are powerful, but also note the symptoms. The symptoms aren't just gynecologic symptoms, right? They go beyond gynecology. So what's happening? Well, this is the concept. Okay, let's talk about this. What's happening? So in premenopause, we are experiencing a lot of changes, right? Just in this time period, there's the normal cycle changes, and some don't experience PMS, no bloating, no other weight gain during their cycles, or moodiness, anxiety, sleep irritability, and others do struggle. And so there may be reasons that, there are certainly reasons that some do better and others don't. We have to always look at the underlying reasons and focus on those. So in this time prior to entering the menopausal time period, PMS can get worse. You can experience PMDD, menstrual weight gain, bloating, painful cycles, vaginal infections, migraines, libido issues, all from these early changes. And now and also with that PMS, that premenstrual cycle changes. And then perimenopause and menopause, this is a time we're like, okay, what's going on with my body? Changes have kicked in full swing, and you may be feeling out of control, even panicked. Progesterone levels are rapidly decreasing with lower fluctuating levels of estrogen, and there is a stronger decline in DHEA, testosterone, and the hormone adiponectin. Adiponectin hormone is really important for our metabolism. So with this combination of declining hormones, there are a couple of hormones that are on the increase, and that is insulin and cortisol. And these are key reasons why the keto green lifestyle works so well in working with women to manage these two inflammatory hormones, insulin and cortisol. And so as we're seeing this natural decline in reproductive hormones, as well as a decline in adiponectin and an increase in insulin and cortisol, it really creates a transitional state that can be very troublesome for many of us. And especially those of us who have had trauma, who have had adverse childhood experiences, because the declining levels of progesterone, which is not just a hormone of gestation, it is a hormone of neuroprotection. Also, it's a hormone known to have receptor sites in our fascia, in our bones, in our brain, and in our breast, and healthy in all of these ways. And we're talking bioidentical progesterone. So we want to improve. We want to improve this transition time as gracefully as possible, and we must intervene. So the symptoms that we're seeing are quite often these neurological symptoms. As I mentioned, the anxiety, the depression, brain fog, memory issues, worsening premenstrual syndrome. I mean, these are neurologic symptoms that are happening along with the endocrine symptoms. So the hot flashes, the weight gain, the irregular menstrual cycles and painful cycles, breast cysts, as well as bladder issues, all can be very common during this time period. And let's not mention how it can affect our relationships with a vaginal dryness, with fewer orgasms, with a lower libido, a lack of sex drive. And I'll share with you a couple cases as we go on. In the post-menopause, we're shouting, okay, now what, right? Now what? What's going on? This should be our second spring, where we are vibrant, active, interested in everything that is going on around us, passionately being that mentor, being that wise woman, being fully engaged in your life, comfortable in your body, and and just at home in your body, at home in this body that has served us and carried us a long, long way. And, by the time that we're in our postmenopause, yes, our reproductive hormone levels have dropped to 60 to 70% of those of what they were when we were younger. But yet many women will still I've had women experience hot flashes for as long as 20 years. And again, there are many reasons for hot flashes, but that is unacceptable. And additionally, the other changes that result from declining hormones: bone loss, memory issues, mood issues, vaginal health decline, incontinence, pelvic floor issues. All of these will continue to worsen if we don't intervene. And it's never too late, but the sooner the better. So prevention is key. And I say that she should follow the keto green way. And that way we can optimize hormone levels with an individualized and functional medicine approach. So look at this curve. Now I want to share with you some really key factors of what's going on here. You see, this is a graph of glucose metabolism in the brain. So look at the red line here. The red line shows glucose metabolism in the brain. And so what's going on here? Our brain uses glucose predominantly for fuel. And this is based on a study published in May of 2015 in Nature's Reviews Endocrinology, called Perimenopause as a Neurologic Transition State. And I couldn't agree more. I was so excited when I read this research because it just brought some aha moments together. So imagine this now. Our brain eats glucose for fuel. We use glucose for fuel in the brain predominantly. But when we get to a low threshold, when glucose is less available and we're digging into our ketones is then the preferred fuel source for the brain. Now, what's going on here then? Why is there this shift over time in the perimenopause, such a decline in the brain's ability to use glucose for fuel? Well, it is because it is an estrogen-dependent phenomenon. So our brain's ability to use glucose for fuel, gluconeogenesis in the brain, is estrogen-dependent. And most likely, look at the slope of that curve, progesterone dependent too. But research is still pending on this. So that's a theoretical surmise on my behalf. But definitely we know that gluconeogenesis in the brain is estrogen dependent with declining levels of estrogen. What we're seeing on imaging of the brain is less uptake of glucose, So what's happening here? What are these symptoms? This black line here I'm showing you are endocrine and neurological symptoms. Well, I've listed them out for you that we associate with perimenopause and estrogen dominance. We associate anxiety, irritability, mood swings, insomnia, restlessness, brain fog, memory loss, forgetfulness, decreased libido, all as neurological symptoms with an endocrinologic basis as well. So this is more than a hormone problem, right? It is a fuel problem. It is a fuel problem. So look again, let's go ahead and talk about some of our stories and our cases, and you'll be able to see. But remember this, consider what's happening to our hormones. So it's a fuel problem. So what I like to say is that glucose is to gasoline, unleaded gasoline, as ketones are to jet fuel. Okay, so glucose is to gasoline as ketones are to jet fuel, especially in the perimenopause. So not only is the ketogene way or getting into ketosis on a regular basis good idea for women, especially those of us over 40, but it is mandatory in my clinical opinion, in my judgment, and working with tens of thousands of women in my online programs, for sure, that I've seen personally completely turn around their lives. Let me share a few stories with you right now. So Linda is a client who came to me at age 39, and she had never had an orgasm. She was in a good marriage. I delivered one of her children. She had 2 children at age 39. Her youngest was 5 years old. She had anxiety, PMS, and also decreased libido. She was in a healthy marriage and had a very, a strong ability to communicate with her husband. And so she came in and confided in me that she had never had an orgasm and she was really struggling. And so for Linda, what did I do? A couple things for Linda that I worked with her to help her understand, number one, okay, her anatomy. It's she has a G spot. Where is that? And one thing that I did with her too is certainly I had to get help heal. If we don't heal our mind, and the brain is the most sexual organ of our bodies, right? So we have to heal our mind. So what's going to help with the PMS, the anxiety, the decreased libido? So part of that is first steps first in my programs. It's keto green, right? We want to detoxify you from sugar. We want to detoxify you from certainly anything that can be an endocrine disruptor and get you eating whole foods. So to start, I typically would do a 21-day detoxification program and put her through that with no white, no wheat, no sweet, and very little red meat. So detoxing from sugar, from all grains, and from dairy as well. And all, and that can make a huge difference. And so with her, started with that, and also worked with her hormones. So adding in a product called Julva, which I created. So just anti-aging cream for the vulva so that she could experience more sensation, and then also optimized her hormones. So using bioidentical progesterone to help the PMS, also using herbal combination of products that I use as my Mighty Maca Plus, which has maca and 30 other superfoods that work together. So that can help naturally produce progesterone, as well as improve DHEA, which is another adrenal hormone, and also assist in detoxification, alkalinization, which is a key component for all my patients. I emphasize an alkaline component to their diet. So dark green leafies, rich of fiber, plant diversity to help the microbiome. And we know that within our gut bacteria produce more serotonin than in our brain. So healthy gut bacteria is not only important for serotonin protection, but also for estrogen metabolism. And so that would help her symptoms of this estrogen dominance in this time period that she was entering of neuroendocrine vulnerability. And so beyond that, I also, again, just informing women like, okay, this is where your G spot is, and to understand that, and showed her husband as well. I did an injection of filler into the G spot, and she called me in the middle of the night one night and told me she was contracting, and she had just had sex and she was experiencing lower abdominal contractions and she wasn't sure what was going on. And that was it. That was a pelvic orgasm. That was the first time in her life that Linda experienced that at age 39, having been married over 15 years. So it really kind of lit a fire in their marriage, and just really helped her, again, have that open, even more open communication with her husband. And that was, that's a beautiful story. So that's Linda. So that anxiety, PMS, decreased libido, all work together to keep you from enjoying life. So in doing these shifts and what I call the keto green way, getting into ketosis to clear your brain, getting alkaline to set a strong foundation, is transformational. And like I have all my patients do, I have them test their urine pH and urine ketones so that you test, don't guess. You can be following a perfect ketogenic diet, but you never know if you're in ketosis if you're not testing. You can test with urine, with blood, with breath, different ways that you can test ketones, as I'm sure you're all aware in this community. But the other really critical component is checking that urine pH, that alkalinity piece, and experiencing what that feels like to be both have an alkaline urine pH and in ketosis at the same time. It's kind of really exciting. So those things make a difference in really stabilizing our blood sugar and stabilizing our cortisol levels, and we move on from there, because it takes more than food, right? It's a lifestyle. It's not just what we eat. It goes beyond this. So let me share a story with you about Maggie, who came to me at age 52. She was complaining of chronically continued heavy, painful periods, worsening with breakthrough bleeding in this perimenopause, and also continued PMS symptoms. She also had significant breast tenderness and worsening anxiety amongst the occasional hot flash. So she needed more than one answer for this range of issues. So we have a selection of solutions that we want to do for a client such as Maggie. So again, the first thing, we got to clean up our diet, right? So here it's a 21-day cleanse to eliminate sugar, caffeine, and alcohol so that we can reboot her system. Checking urine pH and ketones, a critical part. Working with intermittent fasting during this time period, we want to get into ketosis to give us that brain clarity, to make us feel grounded in our body again. And that combination, again, is so powerful. And because on the standard American diet, there are numerous gut issues. As a rule, a regular probiotic is critical. So using a daily probiotic and supporting your gut bacteria is beneficial. So I added that to her, as well as, like everything in the arsenal, right? We're going to do additional support with a bioidentical progesterone and pregnenolone cream. So using that on day 8 through 28 of her cycle to help her regulate her period by using bioidentical progesterone. Because during this stage, that breakthrough bleeding, that brain fog, that anxiety is most certainly a result of insufficient progesterone. There's certainly things that we can do to improve our natural progesterone level. And the first thing is reduce stress, because cortisol robs progesterone from us, right? Cortisol is made from progesterone. So when we are under stress, when we're anxious, when we're worried, when we're fearful, and all of these issues, when business is troublesome, stress, cortisol will decrease our, has to be made from somewhere. It's made from progesterone. As a result, not only is progesterone decreased, but also estrogen and testosterone. So, the combination of our natural hormonal reproductive changes as well as stress is traumatic. And then add in Maggie's case, she had adverse childhood experience. She had a sister that committed suicide when she was only 16, and had a brother with a psychiatric condition. And all of this seemed to come to her at a head, and she was really struggling with all of these symptoms at this time. And so beyond that stress management, the part of testing your urine pH is really key here, because cortisol increases urine acidity. And so if we start to recognize, well, when I meditate, I can, I'm more at peace, but also can check my urine pH and I'm more alkaline. We can do heart math. And that's another thing I prescribed for Maggie, was heart math, which to help increase heart rate variability. And she had the hardest time initially with that, but now is doing so much better. These little tweaks, this ability to measure kind of a biofeedback in a way, these biomarkers really help us gauge our healing journey. So for Maggie, that stress management was really important. Just the way the thoughts in our minds can go and affect our physiology. So real or perceived stress can cause an increase in cortisol, and you can be eating perfectly but still have acidic urine. Urine pH is a vital sign, as important as your temperature, as important as your weight, as important as your blood pressure. So I cannot emphasize enough how it really does help us as individuals do our detective work to empower our bodies. So these were a couple things that really made a huge difference in Maggie's life, and she is now sailing through menopause into her second spring. The keto green diet is always foundational in all of these situations. Once we detox, we're really working, and even in my detox program, we work on an extended fasting interval to help, again, ground, clear, empower our body, get into a state of autophagy and deep ketosis. We do it once we've alkalinized and improved the health of our gut and GI tract as much as possible as well. It's a combination that works beautifully. Now, let me share with you Nina. Nina is 56 years old. She had been divorced for 20 years, raised her kids, and had a new boyfriend, just started dating, and had called me in pain and very concerned. What she was experiencing her third recurrent urinary tract infection. And she said her doctor had recommended that she be put on a daily antibiotic. And she didn't feel right about that. So she said, I had to call my girlfriend doctor and find out. And she said, Dr. Ann, I really don't want to be on a daily antibiotic. What do you recommend? I said, no, of course you don't need to be, first of all. But if we understand what are the physiologic changes that are occurring here. So with our changes in the reproductive hormones, progesterone, estrogen, testosterone, DHEA are all on the decline. The vaginal walls can thin out. The area around the urethra also thins out. And so with intercourse, bacteria can more easily get pushed into the urethra and enter into the bladder and cause an infection. So I said, it's really simple. We have to do a few things. First of all, we have to condition the health of your urethra and vagina so that it's stronger and more resilient, right? This makes sense. This is conversations you typically don't have, right? But maybe not even at a keto conference, but these are important life conversations to have so that you don't continue to suffer in silence. So the first thing is that we have to condition the health of the vulva and the vagina and the urethra, and that makes a difference. So we use my topical formula, which combines DHEA with plant stem cells and emu oil, coconut oil, and shea butter, called Julva. And I told her to apply that daily and then also with intercourse, and begin a probiotic. Take that every night on an empty stomach, along with 2,000 milligrams of vitamin C daily, and to focus on hydration to make sure she's getting enough water before, during, at least before and after sex, maybe not during sex, but all right. So that was important. And then to also urinate after having sex. Well, she has not had another urinary tract infection. So that is good news. And beyond that, she was able to continue to enjoy her relationship, have open conversation, and now they are engaged and have moved in together. And I'm really thrilled to report that, because it could have gone very different. Because if you have pain every time you do something, why would you want to? If you have infection, odor, discharge, discomfort every time you do something, after every time you do something, why would you want to? It is one of those spoken silences that many women never talk about, even with their closest confidant, friend, and or husband, that how this can really create a silent disconnect within our relationship. So being able to restore our health naturally is critically beneficial. And so that's been a really important thing that Nina said. She said, problem totally solved, and doing really well. Now, I'll share with you about Vanessa. Vanessa is a 64-year-old woman who came to me complaining of zero libido and vaginal pain. She'd been post-menopause since she had her hysterectomy. She's been postmenopausal for over, she had a hysterectomy in her 30s. Let me tell you, remember correctly. She had her hysterectomy in her 30s, and that's been a journey. I mean, it was just a journey for her, a difficult time. And then afterwards, she had also an anterior and posterior repair. So that is a bladder surgery repair, also to help what's called prolapse, relaxation of the walls between the vagina and the rectum. So a procedure we call anterior and posterior repair to tighten up the walls of the vagina so that they support both the bladder and the rectum. And so what I evaluated her on examination, that her vaginal area had eroded so much that I could see suture coming from her bladder repair surgery. And that's really significant. Now, beyond this, she had hypertension, high cholesterol, was on a daily antacid medicine, and had migraines every time, it was like every week, and certainly every time she had sex. And so these were all, pain driven, discomfort, nutritionally driven areas that were never addressed. All of them were medicated with one prescription or another. So in a holistic approach, following my Keto Green Plan, an earlier version of my Keto Green Plan, and really working on detoxing her body, eliminating sugars, which is a huge culprit for many of her symptoms, and doing intermittent fasting, so extended intermittent fasting, so that her body had time to digest her food completely. So instead of her current regimen, which was a snacking regimen throughout the day, three square meals a day and 3 snacks. And so no wonder she was on antacid medication as well. So her body had never had a chance to get to a lower glucose level. And she was also fatty acid insufficient. So a couple things here with her: the intermittent fasting, a healthy keto green diet, and with some extended fasting, because we need healthy fats for healthy vaginal tissue. We need healthy fats for healthy hormone production. And this is where ketogenic diet really, really shines, and especially in the peri and post menopause, because this is critical for cell-to-cell communication. So as part of this, as part of her program that I'm addressing as a gynecologist, were these areas as well: nutrition, and to support her, her blood glucose, as well as her blood pressure and her cholesterol levels in this manner, and then support her from a gynecologic approach. And so what do? I prescribed her a vaginal hormone prescription that contained DHEA and testosterone for restoration of the vaginal tissue, along with topically using Julva and adding in a progesterone cream, even though she didn't have a uterus. I believe progesterone is necessary in our postmenopausal time period for all the effects that it does have on the brain, the bones, our breast health, as well as, again, this is bioidentical progesterone. And we've looked at the research that's looked at bioidentical progesterone in women and versus synthetic progesterones, whether they were pregnane or norpregnane derivatives. This study was done on 100,000 women out of France, done by Dr. Fournier, and this has been an ongoing study. And what they showed is that bioidentical progesterone had no increased risk of breast cancer, although synthetic progestins do. So that is a signature difference in using the type of progesterone or progestin that you do use. So always it's bioidentical. So I added that for her, and all of a sudden she said she started sleeping better. She felt like a fog had lifted from her brain. And I hear that every time I've treated a woman in the postmenopause who's had a hysterectomy with bioidentical progesterone. They always tell me, I feel like a fog has lifted. I think better. I feel clear. I feel like my old self again. And I'm sleeping better and more restorative, because progesterone naturally helps us calm and helps us get a good night's sleep. So some great aspects about that. And also when I came, because I was preparing her with the vaginal hormones to do surgery to repair the vaginal erosion, where I could see suture coming through from her former bladder repair surgery. Now, this is really important. You may have seen all the mesh advertisements, mesh lawsuits for bladder repairs that had been on, or for urinary incontinence procedures. A gynecologic procedure, urogynecologic procedure, is to do a mesh or a sling. And there were many mesh erosions because they were missing this piece of using vaginal hormones or something like Julva topically to help keep the tissue healthier, right? To help keep the tissue healthier. So I did a vaginal hormone prescription for her, brought her in for her for her preoperative evaluation. I was ready to repair the vaginal walls. And she goes, Dr. Anna, I've had sex again. I'm having the best orgasm in my life. I don't have pain anymore. I'm having no more issues. And that was so eye-opening, because here I examined her. I said, well, I've got to repair that suture that's eroded through. And on examination, it was no longer visible. It was no longer visible. The vaginal mucosa had repaired itself. The vaginal mucosa, like the oral mucosa in our mouth, repairs itself so well. Given the right ingredients, the right nutrients, right, the right hormones, it repairs itself so well. So the suffering from these consequences of vaginal erosion or vaginal atrophy, are devastating, but are completely reversible for the most part with the right ingredients, the right attention. And so supporting her also for her liver and for her detoxification, for her lipids and her blood pressure. Of course, I put her on a probiotic. You can also do probiotic foods. And in Keto Green 16, my new book, I talk about kimchi and sauerkraut, but fermented foods are an essential part of a healthy diet. And if you're not incorporating fermented foods right now, really, really need to. So, or add a probiotic as well, because we have to keep our gut as healthy as possible. It is our first line of defense. It is the strongest support of our immune system that we have. And it is key to resilience, along with adrenal support is key to resilience. So that's the story of Vanessa. So I share with you that I have products and programs that I've created, but predominantly I've mentioned Mighty Maca Plus, which is a superfood formula that puts together maca, turmeric, quercetin, resveratrol, uña de gata, which is cat's claw herb, and many other superfoods combined to help support PMS, hot flashes, night sweats, mood swings, irritability, helps as an alkalinizer, as well as helps to decrease our appetite, which is super, super nice. So it's one of the essential combinations, one of the essentials in my practice and in my programs. Check your urine pH and ketones. That is critical. Test, don't guess. What gets measured gets managed. And that is, I mean, I just can't emphasize the importance of testing. Check your urine pH. It costs pennies a day and can really give you so much insight into what's going on with your body. And having good meal replacement. Mine is my keto green, 0 grams of sugar, 14 grams of protein per scoop, adding in medium chain triglycerides. You have to get ones that work with you. And there are many available recommended in our keto community that are just fabulous. But check the ingredients. What are the chemicals, et cetera, that are associated with it? Julva is a product I mentioned. It is the anti-aging cream for the vulva. It really does help restore our natural skin elasticity. And then I talked about probiotic, including a multi-strain probiotic or rotating probiotics is important for vaginal health as well as anxiety and neuroendocrine health. Another program that I've created in my online community is Magic Menopause. I know many viewers here probably heard about it, as well as Sexual CPR, which is a lifetime program to really help us reignite our sex drive. And I talk about this because I've lived it. I've had to create solutions for myself where none have existed because my doctor's bag was empty. I was 39 and I was struggling with infertility, with a diagnosis of early menopause. I was told at 39 that I would never be able to conceive another child naturally. And I had failed the highest doses of injectable medications. And that led me on a journey around the world and looking for answers. And that is why I've come up with these answers and written these books to help give everyone, let everyone be empowered as easily as possible so that you are in control of your life and you don't have to suffer unnecessarily. With that result, in my journeys around the world, not only did I come back at a healthier level, having reversed menopause, but I also at age 41 naturally conceived a beautiful baby girl, and without any reproductive endocrinologic medications, without any infertility medications. And so I say this to share with you that there is hope. There is hope no matter what you're dealing with hormonally. And the solutions, this keto green way of life, working through your next right step, there's always a brighter picture for you. And this is where we can rise as phoenixes from the ashes and transform and transition into the healthiest life that we ever had. So I encourage you to follow me at my website or on social media. I love interacting and sharing information and hearing your stories and success stories, as well as knowing your questions and your challenges. So I thank you for being here at KetoCon, and thank you for your time with me today. I appreciate you being here. Don't hesitate to let me know if you have any questions whatsoever.